So good evening, everyone. I welcome you all in today's OET free live webinar. And the topic of today's webinar is scoring high in OET exam and understanding of the assessment criteria. So I'm Dr. Maryam Zulfiqar, OET mentor at MedExam Expert. So let's start our today's webinar. Okay, so let it go. So before proceeding to OET scoring system, I think we all must have review of this exam because it is the very important thing to do. So what actually is OET? What is Occupational English Test? We all know that it is Occupational English Test, which accurately reflects a candidate's ability to communicate in an English-speaking healthcare workplace. Okay? OET reports a scale score of 0 to 500 and a letter grade from A to E for each individual subtest. OET does not report overall scores or grades. So this is the basic understanding of Occupational English Test, that why you need that test. And it is the scale and the grade from 0 to 500. It is a scale, which is a score basically. And the grade is A to E, whether on which grade and on which score you are lying. So designed for healthcare professionals, the OET is an English language test that assesses a person's English reading, listening, writing, speaking capabilities within a medical or healthcare setting. OET is trusted by regulators, hospital, universities in the UK, US, Ireland, Australia, New Zealand, Dubai, and Singapore as a proof of ability to communicate effectively. So this is the brief overview of OET exam. And I think you all must be knowing very well that how many modules it contains, what is the cost of the exam, what about the venue centers, because we have discussed these things in a number of multiple webinars. So today's webinar is regarding OET scoring system and how you can score high in that exam. So this is the grading and the scoring system from the official OET website, which you can see on the screen that OET result, if your grade is A, what must be your score? It is from 450 to 500. As we know that the total score is 500. So if you are lying anywhere between 450 to 500, then it is sure that your grade is A grade. Okay, and there is a little bit of description that what are A graders known as, like communicate very fluently and effectively with patients and healthcare professionals using appropriate register, tone and lexis, shows complete understanding of any kind of written or spoken English. So this is all about A grade takers, and your score will be around 450 to 500. Now there comes B grade, and the B grade is when you are going to score 440, 350 to 440. Then it is you are lying in grade B, and this means that you can communicate effectively with patients and health professionals using appropriate register, tone, and lexis with only occasional inaccuracies and hesitations. Shows good understanding in a range of clinical context. So the thing is, the B grade is the grade which is the requirement of most of the international healthcare system. So if you are planning to go to Ireland, planning to go to England, if you are taking steps, you are planning to go to Dubai, any of the world, majority countries have set their standard and their grading system. The grade which you require is B. So you must score 350 to 440. If your score is somewhat in this range and it is 350 to 440, then you are safe and you can easily apply to that country. Now there comes C plus, and the C plus is also a requirement in some of the cases, like for the nursing students, for the GMC and IMC, the writing criteria, writing module if you are scoring for the nursing student only, I'm not talking about the medical student. If you are scoring C+, then you are also eligible for applying. And then there comes C. C is saying that you can maintain the interaction in the relevant healthcare environment despite occasional errors and lapses and followed standard spoken language normally encountered in her field of specialization. So the thing is C grade, and after that there is D grade and E grade. So these are not really acceptable. So we will not discuss these things because it is just a useless way of talking, like if we are going to discuss it from C to E grade. So the thing is, you must be anywhere between A, B, or in some cases, like the special cases I told you about, the C+. Now we know that OET is having four modules: listening, reading, writing, and speaking. So the thing is, we have to understand each and every module's scoring criteria. If we know this thing, then it would be easy for us to ace our required grade, our required score. So for the OET listening, we know that total marks are 42. So use the calculator to find out how many correct answers you would need to get a B grade in reading and listening modules. As per the OET website, one typically needs 30 marks from 42 questions to get a grade B. So if the total number are 42 and the total score is 500 according to number 42, so if one is going to score 30 out of 42, he or she may be having 350 in approximation of that 30 marks. So 350, if you are scoring 350, your grade is B. If it is below 350, it must be C+, it must be C, it must be D, anywhere, any other grade may be. But if your if you are scoring 350 or above 350, then surely it must be B or A. Then you are in safe hands. The OET listening paper are marked by a combination of assessors and computers. For part A, which is the task that requires the test taker to fill in the set of notes about a consultation between a doctor and a patient, assessor marks the answer, and the other parts of the OET listening paper, part B and part C, are computer scanned as they are multiple choice tasks. Part B includes that 6 short conversation and monologues that include different healthcare professionals such as nurses, doctors, occupational therapists, and ward leaders. And the part C features 2 longer presentations or interviews on journal healthcare topics. So this is the brief overview of OET listening. So the thing is, OET listening part A is double marked, meaning 2 OET assessors check the answers. Both assessors use a very detailed marking guide that clearly shows which answers are to receive marks. The guide is to help assessors determine if you, the test taker, have provided enough of the correct answer to receive a mark. So the thing is, most of the time, aspirants want to know that if their score is not the achievable one, like the B grade, and they think that, okay, I should go for a remark and I should go for a rechecking. So the thing is, for the listening and the reading part, it is totally a waste. If you guys think that you are going for a rechecking and a remarking for the listening and reading of the OET exam, it is totally a waste. It is just a useless thing because I'm telling you the official OET criteria of your marking and all. So your marks will not increase in these 2 subtests because these are double checked. This is not the thing that you are only computer based checking. It is computer based, but still it is a double check thing. So there is not any margin of increasing your marks in listening and reading. If you think that with the help of rechecking and the remarking, you may be able to increase some marks. So it is totally a waste. And for the listening, for the writing and the speaking, there is always a margin, but if you are lying very close to the passing criteria, suppose if you are having 330 and 340, then you are just a 10 minutes or a 20 minutes, you're very close to the passing criteria, which is 350. Then there is always a margin that you can improve in these two subtests, just for the writing and the speaking. I'm telling you this thing because I used to get a number of queries regarding this thing, the remarking thing, that ma'am, if I'm going to apply for remarking of listening and reading, would my marks increase? So the answer is no, complete no. So I think you should prepare first the test very well. So I think anyone can pass this exam because this is not a very difficult exam. I will also tell you the tricks to ace these modules as well. So the thing is, assessors also have to make sure you have not included any conflicting information to your answers that make your meaning unclear. This means that you should try to keep your answers short, that you don't include extra information that may contradict with the correct part of your answer. Because some of the time we think that if we are writing this, this, and this as well, because a number of students do what? They used to write the answer, and if they think that, okay, this is also, this can be the answer, I think I hear this as well, they do what? They write one word slash second word slash third word. So if you are going to do this, then what is the answer? You are actually confused. You even don't know that what actual is the answer. You are just going on putting slash, and you are just making this thing that if examiner pick this out, and if computer pick this word out, maybe I am among the past candidates. So be very particular about this thing. Just write one word. Don't try to put 3 and 4 words by the help of slashes. So I think it is not very advisable thing. And it is important to keep in mind that part A does not require you to paraphrase what you hear in the audio. You must complete the notes with the same words you hear on the recording, such as the name and the description of the medical condition, the name of the medication, or a type of laboratory test. So I think, in my opinion, part A is the easiest one. It is the easiest one because there are, if you are going to practice 30 to 35 tests, I'm sure that you will easily ace the listening module of OET exam. Okay. So here is a trick to get 30 out of 42 and 30 plus as well in listening module. Sorry. Try to correct all 24 in part A. And how you can do this? I was telling you that if you are going to attempt 30 or 35 tests before your real exam, then it would be easy for you to get all 24 corrected, because with the help of practicing, you may be noticing that some of the words are repeating in part A. Just like the thing I discussed, that it is important to keep in mind that part A does not require you to paraphrase. You have to just put down the word you hear. It may be the name, it may be the description, it may be the dose of the medication, it may be the name of the disease. And there are some words which are very common in OET exam, and they use to repeat in the exam. So the thing is, if you are going to practice this number of tests, I'm sure that you can easily get 30 out of 42. And for the part B, it is also very necessary if you are going to score 6 out of 6 in part B, and then you will be having margin of doing mistakes in part C, which actually is difficult and challenging. Okay, so you can easily count it that 24 plus 6 is 30, and you still have 12 questions in part C. And if you think that you, because a lot of students say that part C is undoable. So if you think that although it is not undoable, I admit that it is difficult, it is challenging, but it is not undoable. But the thing is, if you think that, okay, suppose if it is undoable, then if you are going to correct 24 and 6 all correct, then you can easily do a mistake in part C. But the thing is, for this, try at least 30 to 35 tests for practice, before real exam. Then your score in OET listening will reach 30 plus in the real exam. And let me tell you, if you are going to follow my advice, follow my words, if you are going to practice these number of tests, then I'm sure that if you are scoring 30, 31, 32 in your practicing test, then your score in the real exam would be around 33, 34, 32 as well. Okay, so always try to practice maximum number of texts, and this is the average. I told you that 32, 35. Now comes to the OET reading, and we all know that there is also a total of 42 marks available in the reading subtest. Part A accounts for 20 marks, Part B accounts for 6 marks, and Part C accounts for 16 marks. So the thing is all the same regarding OET reading as well as OET listening. Here are 5 ways to read faster and tips for approaching OET Part A, reading Part A. So as well as I told you in listening, just like listening, what you should do in reading part, you should be very particular about Part A. We know that these are 20 questions, and if you are going to correct all these 20 right, then you are having further 10 a number left to reach your desired grade, which is B grade. So always begin with a skimming. Skimming is the technique you are just going for a proofreading, whatever it is written. Okay. Then you are going to highlighting the keywords. For the reading, I must say that highlighting the keyword is a very, very important method. Furthermore, there is also a method called elimination method. I'm just telling this thing for the Part B and Part C of the reading, because the thing is, if you have figured out the keywords and you are just finding your answer, then elimination method is the must method to do. You have to read the options and you think that, okay, this is not going to be fitting here, then cut it. For option B, you think that, okay, option B is also not suitable. Then you're just having option C in front of you, and this is your answer. So I always advise my students that always go for elimination method. It is the best technique to find out your answer. Retain exactly what you read and be prepared to read a question, skip the options. What you have to do, you just have to read your question and then you have switch to the paragraph, whatever it is written in the paragraph. If you are going to read the question and then you are going to read the options as well, before reading the paragraph, you will get confused. So for the OET reading, it is the best technique that you just first read the question, switch to the paragraph, because you have to figure out your keyword. If it is mentioned, suppose we have a question that you have to tell the significance of LFTs. Okay, so you have to check the significance of LFTs. We don't have to take into account that how do we perform LFT, for which diagnostic purpose it is used and all. Where you find a word significance, you have to figure it out in the paragraph as well. Moreover, if you have highlighted both the keywords in the question and the paragraph, then go for the options. And I'm sure that 80% of the time you select your answer with the help of elimination technique. If A is not the choice, cross it. B is not a choice according to you, cross it. Then select C. C must be the answer. Okay. So provide yourself with plenty of practice, because there comes another question that what should we do regarding OET reading Part A, because it is, we are having just 15 minutes and we have to solve 20 questions. Trust me, I am repeating it again. If you are practicing OET reading like 30 to 40 tests, your Part A, you will score 20 out of 20 on the exam day. It is a very, very easy subtest. So please don't lose your margin for losing your marks in Part A and Part B. So if you are going to correct all 20 and all 6 corrects in Part A and Part B, then you must be having 4 more questions, and it is very easy to get 4 marks in Part C, because you have total 16 questions. Okay, so try to correct all 20 in Part A and all 6 in part B, which is not difficult task to do. You will margin of doing mistakes in part C, which actually is difficult and challenging. For this, try at least 30 to 35 tests. I'm just telling the average limit. For practice before a real exam, then your score in OET listening will reach 30 plus in real exam. So now comes to third subtest, which is OET writing scoring criteria, and how many points you need to score grade B in OET writing. So this is the very interesting module, I think, because I myself is a writing mentor. So I think I am very much able to tell you about the writing scoring system as well, because the thing is, I personally think that this is the most easiest subtest of the OET exam. But the condition is you first understood all the prerequisites and the essentials of OET writing. Trust me, if you are having all the proper guidance, all the knowledge, because I have seen a number of aspirants who start from just the scratch, they are at the 0. And on the letter number 5 or letter number 6, letter number 7, they are just doing the amazing performance. I have encountered a number of students, okay? So how many points you need to score grade B in OET writing? Total marks you can get is 38 points, okay? So 38 points means 500. Total score is 500. You need to score the following for grade B. First of all, in the OET letter writing, there is a thing which is purpose. And trust me, I used to repeat this thing. I used to reiterate this thing to my course student, to any other student, which is a mock student, any of the student. If your purpose is written beautifully, if it is having the things which examiner want to see, trust me, you are going to get 2 out of 3. Because getting 3 out of 3 is a little bit difficult, but 2 out of 3, if it is 2 out of 3, you are surely going to score grade B if your letter is only having other minor mistake, because these can be neglected. But if purpose is having 1 out of 3, it is very, very just near to impossible that you are going to get B. So trust my words, if your purpose is very good, and how you can write a good purpose, you can easily see the level of those students and the level of those letters who are having good purpose in their letter. Most of the time, the letter is so much average and so much satisfactory, but their purpose is very good, and you can ask those students that what was their score in the mock. I used to give them around 360 or 370 because their purpose is so much wonderful. Anyhow, the other things are, I'm not saying that other things are not being followed. Other things are followed, but these are just the satisfactory things. But I think that if the purpose of the letter is so much beautiful, it is having the information which must be in the purpose. So I'm sure that you are going to get grade B. Then there comes the content. And for the content, it is having 7 marks, and you should obtain 5 out of 7. And for the conciseness and the clarity, it means that you should write relevant information, and you should be clear in your stance that what are you writing, and it should be concise. It matters a lot, you know that, because the word count ranges, we know that it is 180 to 200. So I think if your letter is in this word count limit, then you are surely going to get grade B. And then there comes the style of the letter, which is basically you are following the pattern of the letter or not. Because it is not just the thing, lot of aspirants used to say that it is something like that when we are going to send a call from one department to another department during our house job or internship or any other you supposed to say any of the duty. So answer is no, it is not like that. If you are thinking this thing, it can be somewhat similar to this thing, but in reality it is not, because OET letter writing is not just about OET referral letters. It can be discharge letter, it can be transfer letter, it can be urgent referral letter. Then how you are going to tell someone that Don't worry, it is just like a call from one department to another department, because I have seen a number of aspirants who used to misguide other students that it is just a call from one department to another department. For referral letter, we can use this knowledge, but for the discharge, transfer letter, urgent referral letter, it is not the same thing. Because there was a student, I think in July batch, and he took all the modules from us except writing. And let me tell you, it is a very true story. And that person was saying to me that, ma'am, I couldn't subscribe for the writing because my friend told me that it is just like a call from one department to another department. And he told me all the essentials of OET writing. And I think that I can pass this exam easily. So I tell him that, okay, that's very good. But at his result day, all the other modules were passed and the writing was not passed. So the thing is, his friend actually misguided him, because he was just knowing that how to write a referral letter. On the exam day, unfortunately, he got discharge letter, and he was not knowing the format and the pattern of discharge letter. So all these four kind of letters are not the same. These are based on different formats. Okay. So never ever misguided by anyone who is going to say that it is just like a call from one department to another department. Anyhow, so organization and layout is also having 7 marks, and if you are going to score 5, then it is very good. Language, it is basically your grammar and all your spelling mistake, vocabulary, what kind of word you are using. So it is also containing 7 marks, and you should score 5 out of it. So total, if you are going to score 27 out of 38, then it is surely a B grade, which is 350 out of 500. So OET writing scoring criteria is what I have told you, the purpose, content. These are the definitions actually of these things, so that it must be easy for all of you to understand that what actually is the OET writing. So the purpose should be easily and immediately identifiable for the reader. So there is no search for it. Like, examiner don't get confused at what his candidate wants to express, what he is want to say. So your purpose must be having the accurate information. And if any of the course student is present in the webinar, I don't know about the participants, but if someone is present, then he or she can tell you that what is actually the purpose of OET letter writing. So after that, there is a content, key information is included and no important detail missing. So content, it is about, you have to stick to the key information, that what you have conveyed to the other person. And one thing more, that no important details are missing. If you are going to miss any important detail, it will definitely go for a negative marking. So concise and clarity, no irrelevant information. Information is summarized effectively and presented clearly. This is another important thing, because the thing is, students think that OET letter writing is just a copy pasting thing. No, it is not like that. You have to concise, you have to summarize your information. Then there comes genuine style. It is appropriateness of your letter based on your reader. Okay. Your register, your tone should be professional and appropriate to the document's purpose and audience. So because it is a language test, you know that, and it is acceptable at international level, so it should be very appropriate and it should be showing signs of professionalism. Then there comes organization and layout. Key information is highlighted and subsections are well organized. So this is basically called format of the letter, pattern of the letter, sequence of the paragraphs. Key information is highlighted and subsections are well organized, such that reader can retrieve information quickly and easily. I told you there are 4 kind of letter, and every 4 kind of letter is having different format as well as different arrangement and organization of paragraphs. So then there comes the language, which is spelling, punctuation, vocabulary, grammar, sentence structure. These all must be accurate and do not interfere with the meaning. So we are now having we will now having a few words on OET speaking, because we know that this is the last subtest of the OET. And for the OET speaking, what actually does happen in the OET speaking, that you complete 2 role plays. with an interlocutor, and you play the role play of your profession. For example, you can be a nurse, you can be a doctor, you can be a physiotherapist, and the interlocutor plays the role play of your patient or the carer. You are given all the information you need on a role play card, and you have 3 minutes per role play to prepare. Not only is this more comfortable scenario for you as a healthcare worker, but it also means that as you are preparing for the test, you are improving the language and clinical skills for your future workplace. So how you are scored in OET speaking. Now we will discuss about this. So the thing is, your role play are recorded and assessed by at least 2 trained OET assessors. So this is a very good thing because you will be recorded. You are not assessed by the person in front of you, which is your interlocutor. This is a lot of misconception by a lot of aspirants. They think that they are going to be assessed by the person who is sitting in front of them, who's basically their interlocutor. So that person is not going to assess you. Your role plays are recorded and assessed by at least 2 trained OET assessors. They rate your speaking performance using linguistic and clinical communication criteria. OET speaking is assessed upon 2 criteria. It is not only the English language test, like how beautifully you can speak English, how fluently you can speak English. It is linguistic as well as communication skills. So linguistic criteria, there are total 6 marks for each factor of linguistic criteria. And these are some of the factors which are included in linguistic criteria, which is intelligibility. This means being able to speak clearly so others can understand you. You need to pronounce words and sounds clearly, use the right tone of voice, and use stress and rhythm in your sentences. Then there comes a fluency. This means speaking smoothly and at the right speed. You should not speak too fast or too slow, and you should not pause too much or hesitate when you speak. Then there comes appropriateness of language. This criterion considers how you use the right words and tone for the situation and the patient. Resources of grammar and expression. This means use wide range of vocabulary and grammar correctly. You should be able to express your ideas clearly and without confusion. Then there comes, these all will carry 6 marks. Okay, 6 marks each. These were for the linguistic criteria. Now we are talking about clinical communication criteria. And for clinical communication criteria, all these factors which are included in it, these are having 3 marks. First of all is relationship building. This means starting the conversation in a friendly and respectful way, listening carefully to the patient, not judging the patient, and showing understanding for their feelings and situation. Understanding and incorporating the patient's perspective. Let me tell you, if you are going to follow the clinical communication criteria very carefully, although it is carrying less marks, still, if you are following this criteria very beautifully and very effectively, your OET speaking is past 1. Okay? Because what you have to do is, you just have to do what your patient is saying. Okay? You have to go with your patient words. First thing is relationship building. It must be very effective way of communication between you and your patient. Then there is the patient perspective. This involves asking about and understanding the patient thoughts, worries, and expectations. Most of the aspirants keep on talking, keep on speaking the role play card. They don't even bother to feel that is there anybody other present other than him or her. So your patient is the important and the pivotal part of your role play. So always try to involve and engage that person in your speaking. Always ask his thought, his worries, his expectations. If you are going to do this, I'm sure you are going to get grade B in OET speaking. So you should also respond to the patient hints or changes in behavior. Then providing structure. This means organizing the conversation in a logical way, clearly indicating when you change the topic and using techniques to make your explanation clear and organized. Then there comes information gathering and information giving. So these 5 factors are for clinical skills criteria of OET speaking. And for the information gathering, it means listening carefully to the patient's story, asking open question at first, and then more specific question. Not asking confusion or leading question, asking for more details when needed, and summarizing the information to check for understanding. So the thing is, once you listen all the things patient have told you, then you should summarize in front of the patient. Okay, Mr. John, you have tell me this thing. You are diagnosed with the disease. Now your status of disease is this. Now you are taking these medication. Am I right? So it creates a thing that patient thinks that, okay, my doctor is so much affectionate towards me. He is listening every bit of me. So it creates a chance of relationship building between the patient and the doctor, and this is a very good thing. If you are going to follow it in your speaking role play, I'm sure that you will get grade B. Then information giving. This involves finding out what the patient already knows, pausing when giving information to check for understanding, encouraging the patient to share their reaction or feelings, checking if the patient has understood the information, and finding out what more information the patient needs. Think about giving a patient their test results. You would first find out what they already know, then explains the result, pausing to check for further understanding and to answer any questions. So the thing is, you can ask the patient as well, okay, what do you know about this disease? What is your understanding regarding this disease? So in this way, first get an idea of the patient's knowledge and then let him know that what actually is the problem. So these are the very, very basic points to get right in the speaking module. Students think that if they are going to cover all the bullet points in a time, it is a great success. No, it is not a great success, because most of the time aspirants used to cover all the bullet points and still there is time remaining, and they think that if they have covered all the bullet points, they are done with OET speaking. No, it is a complete no. You are assessed upon these factors. So always try to follow these factors and then you can easily get grade B. Now, I would like to share a news with all of you that we are going to launch our next course, OET regular course from 18th of October. And in this course, you will be having 16 live practice sessions for all 4 modules, and practice exercises for all the 4 modules, live letter assessment. As I told you that I am OET writing mentor, and I cover all the lectures of the OET writing. So my mode of working is that I used to give assignment to the student in the study room after the first session, and in the session number 2 to 4, we go on live assessment of the letters in front of everyone. Everybody will get assessed, and you should not worry about the thing that, ma'am, my letter is not assessed. Anyhow, all letters are assessed in the order of submission. Okay, and the thing is, there is someone whose video is on. Kindly switch it off. Anyhow, so in the session number 2 to 4, you will be having live assessment with me, and I will go for assessing all the letters, and nobody will be left for this assessment. But it is a very, very effective way of boosting your writing skills, because if you're going to get assessed in front of 20 or 30 students in the live class, it will give you a confidence of letter writing. Because at the very start, students don't bother to write. They think that they are not very confident enough to write a good letter, and they think that other aspirants are doing very well than me. Let me tell you, you all are at the same place when you are going to join our course. So please don't get confused, don't get hesitated. Always write and always submit your letters. I used to give this advice to everybody. And moreover, you will be having speaking practice with individualized feedback. As in the September batch, I'm also taking speaking sessions as well. So the mode of working is that I used to select the role play card, and I choose 2 students. One is playing the part of a doctor and one is playing the part of an interlocutor. So the doctor will be assessed, and he or she will be given the detailed feedback that what are his or her lacking and how can he or she perform well in the OET speaking. So it is not only about the live session, you will be given session recordings as well, and then mock exam for final evaluation. And for sure, the med exam website is there on which you can access a lot of study material, because nowadays students also want for the updated letters, they want to assess, they want to practice something new. So don't worry about this thing, because on the med exam website, you will be having the updated material for the OET exam as well, and 24/7 technical support and easy to follow the schedule. So now you guys have any question, please ask question. And thank you very much for your presence. Now I'm going to, okay. So now you guys have any question, please let me know. Okay, so there are some of the queries in the comment box, and I am going to address all the queries one by one. Can we get PDF after completion of this meeting? I think he's asking for recording. Yes, recording will be uploaded by tomorrow on the MedExam YouTube channel. You can easily search it. So in reading part A, if we don't find the answer in the text, can we write the word which has same meaning? Like if we can write titrated in place of adjusted, so can we get marks? No. If you are going to write it, you will not get any marks. And if we have completed JSON files, do we need to do benchmark as well? It depends that how much you are scoring. If you think that your score is around 30 and 30 plus, then I think there is no need. But still, we know that practice as much as you can, it is a good thing. And if you think that you should try something other material like benchmark and Maggie Ryan, because there are multiple sources for OET preparation. So I think you must go for it. So
Hello, doctor.
Hello.
Hello, I am Islam Saudi. Hello.
Yes. Hello.
Can you ask your question?
Yes, please ask your question.
Okay. How many time I want for preparation for OET in the exam? Is 1 month enough or 2?
Okay, so it really depends, and it varies from individual to individual. But on average, I think 1 month to 1.5 months, it is the appropriate time for OET preparation. So if you are having this much time, you can easily prepare it.
Okay, thank you.
You're welcome. So I think Ramesh has shared our free group guide link, and we used to do activities from every Monday to Friday. And you will be shared with the schedule as well, because on Monday there is a journal discussion QRI day, and then Tuesday it is a reading day. Wednesday we used to conduct quiz as well as listening, and on Thursday we used to do speaking, address all the speaking queries, and on Friday letter assessment is there. So you all can join the group, and there is what will be the timing of the practice. Practice would be around 5 p.m. GMT, because I'm not very sure about the exact time, because due to my job, some of the time it is 5 p.m. GMT, some of the time it is 5:30 p.m. GMT, some of the time it is 6 p.m. GMT as well. So it would be around this hour. So any other query? If you guys have any query regarding today's webinar, any of the module regarding our course, if you have any question in your mind, please ask. So I think there are no more queries. And how to improve reading score. Okay, Sidra, I told you that Reading is just about practice, and I think you must invest your time in part A and part B. If you feel that all your questions in part A and part B are going to be correct, then I think you are on a safe level. Because if you are scoring 26 out of 26, both in part A and B, then I'm pretty sure that on exam day you will be having 32 and 34 something in your exam. Okay. So if the time is 5 GMT, the Pakistan time will be, I think, 10 p.m. Yeah, it is 10 p.m. Okay, so any
I
other
have a
questions?
question.
Yes, please.
If in the speaking session there is you brought a child and with you, so what should the doctor introduce about the parent or about the child name?
You must be having clear instructions in the role play card that parent has brought his child and all that. So I think advisable is that first introduce yourself. Hello, good morning. If I were you, I was like, hello, good morning. I'm Dr. Maryam Zulfiqar. I'm one of the treating doctor today. How may I help you? And if the carer is telling you the condition that I brought my child, then you should ask, okay, I'm so sorry to hear that. You must be in so much pain. So can you please confirm the name and age of your child, please? So it is the best way to start your speaking module.
Okay.
Okay, so I think all the queries have been addressed, and Ramesh has shared our WhatsApp group link here. And she has also, yeah, it is free OET practice with Dr. Maryam Zulfiqar. It's me in our guide group every Monday to Friday. It's 5 p.m. GMT. I told you that time would be around 5 p.m. GMT. So don't skip this opportunity. I think it is very good for all of you. So do you guys have any other question? Please let me know so that I may address all your queries. Moreover, if you have, you think that it was a good webinar, we are waiting for your reviews in our feedback. Please join our group.
Yes,
And
I have one question.
yes, please.
Yes, I can, for this listening practice, I can repeat this material test sample, or I am searching for recent exam.
Sorry, I'm unable to understand. Please repeat what are you.
Listening.
Yes, for the listening.
For
What
listening,
is
listening practice? I can repeat the material I listened before, or I am searching for recent exam samples.
okay? So yes, you can, because the thing is, I think it is very advisable. First, if you are if you have practiced a test and you are not getting grade B in that test, I think advisable thing is you should go for the answer key and you have to listen it again, that why you skipped that one and why you didn't wrote this. So this is the best thing to do, and then you should check your score, that now after repeating the same test, what is your score.
Okay. Thank you.
You're welcome. So any
I have
other
another
question?
question.
Yes, please.
If it's a follow-up visit in speaking session, and then the doctor is going to tell the details, or the patient is going to summarize the initial condition, or what should be the start of the session?
Okay, so the thing is, always ask your patient. I told you in the session that it is information gathering. So always go for information gathering. First, you should see that what your patient knows. Always ask
Okay.
him or her that why he is here today. Okay, then go for
Yes.
explaining the things you want to tell him or her. Okay.
In follow-up visit, like there is given your patient came with the follow-up visit after 4 days.
Even if it is follow-up visit, still you have to do the same practice.
Okay. Thank you.
Okay. So there's a query by Dr. Zainab. What is the duration of the course going to start on 18? Yeah, Ramesh has answered it. It is 1 month. Our every course is for the duration of 1 month. It is, if it is going to start on 18, then it will probably end on 18 of November. Okay, so I think all queries have been addressed. And thank you so much, all of you, for your participation today. And please don't forget to write your reviews. Ramesh has shared the link of the free group. Please join this group right now and please share your reviews regarding today's webinar. Still, you guys need any help in OET exam, med exam expert is here to help you. Thank you so much. Allah Hafiz.